In this lesson, we will focus on the mechanical approach to minimally invasive dentistry. As we talked in the anatomical approach, we are focusing on a tooth, an individual tooth and its anatomy. The mechanical approach is a little bit different because it is the relation of that tooth with the collateral teeth, the opponent teeth, and of course all the stomatognatic system, the muscles and the TMJs included. So as you can imagine, when you think minimally invasive, you want to provide not only the aesthetic result, but you want to provide a long-lasting mechanical result. So you need to diagnose prior to start if you have any risky situation regarding, for instance, the intermaxillary relationship, the skeletal relationship, or if you have any problem with the in the muscle activity, any trigger point, any problem whatsoever, as well to understand if you have any problem on the TMJs. And I say this because when you rehabilitate, you have normally an unstable situation, a disequilibrium, and you want to equilibrate. You want to create a stable situation. So if your starting point is an unstable situation, and if you have symptoms or if you have signs of that problem in muscles, in the TMJ, then you need to understand if what functionally is in place can be corrected by your action only, or if you need any other help, or if you need any other treatment before you even start yours. For instance, as an example, if you need orthodontic treatment. Orthodontic treatment is also about being minimally invasive. Sometimes you can have a color problem, tetracycline pigmentation, for instance, and you need to provide an aesthetic treatment, but you have at the same time a lot of crowded teeth and bad functional relationship between them. Then, of course, this as a diagnosed should be planned with orthodontics first and then your treatment, because orthodontics will position teeth in a way that when you will treat, when you will prepare, you will keep much more structure than in a case if you have, for instance, distal rotation of a tooth or a buccally positioned tooth, in which, of course, to achieve a contour or aesthetic result, you will need to preparate much more of that structure, and so maybe be invasive towards dentin, and that is not good. So that is one of the issues. Another issue is the intermaxillary relationship. Sometimes what you face is the need to treat patients that have, for instance, class 2 division 2 of angle, or even a class 2 division 1, or even a class 3. And all these steps are very different, and all these cases, sorry, are very different to treat, because most of them need a prior orthodontic treatment to get a better functional positioning and a better placement of those teeth before you act. Also, it is very important to understand that if you plan orthodontic treatment before yours, sometimes, I would say most of the times, you will finish treating and preparing less teeth than the ones that you would maybe think you would need to prepare at first. So this is about the mechanical properties. Also, don't forget the mechanical properties are related to the area that you are rehabilitating. For instance, the anterior region is very important, I would say crucial, for the outcome of your general treatment and the stability of your patient during lifetime, because the anterior guidance and the canine guidance, the bilateral canine guidance, are the protection of the TMJs, of the muscles, of all the stomatognatic system. So, as we will detail further, the mechanical approach to minimally invasive dentistry is about diagnosing any muscular problem prior to treatment, any TMJ problem prior to treatment, symptom or sign, or also evaluating the intermaxillary relationship altogether to understand if we need a treatment before we even act with ours.